I'm Reg Joseph, CEO of Health City. Health City is an economic development organization focused to develop the health industry in our jurisdiction.
So, Reg, tell us a little bit more about your vision, health in the future global demographic. How can we predict and prevent chronic disease, mainly to change the trajectory of health?
As you know, chronic disease is one of the key issues that faces Western health systems today. The cost of chronic disease through cardiovascular disease, diabetes, and mental health is immense, and we're not doing well as a society in terms of managing these diseases. More importantly, we should be looking at preventing these diseases.
What type of diseases, the big ones that really should we be focused on, or what is the interest of where Health City is being located in Edmonton, Alberta, and you're drawing upon your resources and the talent here?
So the most important diseases that we're battling right now from a society perspective is diabetes and obesity, cardiovascular disease, and mental health.
And in terms of the initiatives, are there initiatives that Health City is focused on right now that deal with these? Can you talk about a few of these just in highlights?
Sure. In terms of initiatives, we are partnering with a number of organizations in our jurisdiction, primary care networks, Alberta Health Services, and even social services organizations like SAGE, which is a senior serving organization. All have various programs directed towards preventing and managing chronic disease.
So when you mention SAGE, that's really addressing seniors in the community and the aging demographic, the geriatrics. I know there's a lot of focus on youth and preventative initiatives. In terms of geriatrics, that's sort of been a missed area, and I'm glad you brought up SAGE. How can the community better participate to accelerate and focus a little bit more on the geriatric population, which is growing?
So the seniors population is a big challenge in many societies, and the reason is because of the complicated scenario and multiple diseases. And so what you have here are complex patients that have multiple ailments that they're suffering from. The challenge in our acute-based system is that we tend to be focused on one particular disease or one particular action, and that rarely takes a look at the entire patient and tries to address their needs overall. Organizations like SAGE and others in this ecosystem are starting to blend together both social services and health services so that they can take a look at the entire individual, everything from the complex diseases that they're suffering from to simple things like mobility and loneliness.
And mental health is a key issue as well, and that addresses age demographic across the whole sector.
Mental health is key. When we look at where mental health plays from a demographic perspective, it plays, as we know, with youth in terms of stress in school and so forth, and societal pressures, all the way to senior citizens when they're trying to manage loneliness and changes in their various aspects of life.
That's great. That's now that we've covered the first two questions. We look forward to our next episode in talking about where should we focus. Thanks, Reg.
Thank you.